said two. I said two, not one.
Okay, so what's the topic for today?
Communication in pediatrics.
Okay, yep. So communication in pediatrics. Let's see.
Wait, why are we in the trios? You went at duos.
All right. So, okay, can you see my slide?
This game is so.
Yes, doctor.
Okay, all right. So this topic, communication in pediatrics, is a rather new topic. So I think we have started only teaching this topic since I think mid of 2020, which is I think, or is it probably from March, probably from March or April. So only few groups. I think last batch was there's only 3 groups probably that received this lecture, and I think you are the second group for this year. Well, you are the second group this year, so to receive this topic. So why we put this topic? Basically for several reasons. Firstly is basically because we from our assessment, because those third years who are in the new curriculum, they have this man OSCE session. So man OSCE session, there are several stations where we assess communication. And the thing is, when we assess communication, we noted that the students usually perform very I'm not wrong kan? Betul kan? Fifth year ke third year? Okay, so and then the other thing is, you guys are fifth year. Even though you guys are fifth year, you guys are in the old curriculum. Long case and short case, we have to do the modified long case. And the problem with modified long case is the element of the session is mainly about communication, how you communicate with your patient, how you, because you club the patient when 2 examiners are there with you. And the past, the batch that was before you, the fifth year, the final year that just graduated recently, the is actually the communication. So communication is actually very important, and I see our assessment is that our students do not perform really well in communication settings. I think that's a problem with our culture as well. We are not trained well in terms of communication as compared to other communities. So I've been residents in UK. Different is that the capability of communicating well, because they are because how they are trained. Can you hear me, or is it too lagging?
Sometimes it's stuck.
Sometimes it's stuck, is it? Okay, wait. Let me see if I can switch to. Right. Okay, sorry. Let me see if I can switch to another. Where is it? Sorry.
But you like it's called illegal.
Okay, sorry. Let me
illegal,
see.
right? That means it's not legal. It's in the legal.
This should already be there.
Technically, it's legal.
Okay, sorry. Let me change my Wi-Fi.
Let's go to PlayStation.
Ah, hello. Sorry. Okay, let's get back. Is it better now or is it still the same?
Better now, I think.
Better.
No, okay. Hopefully it's okay. So where was I? Okay, so basically my point is we need to improve in terms of communication. The next thing is um among the problem why we have lots of medical legal cases is basically because of poor breakdown in communication. If you look at all the cases, most of the medical litigation cases, majority is actually because of communication breakdown. So that is why having good communication in medical practice is actually very, very important. If you know what is the question to ask, if you can communicate well, that is the only way how you can get good history. If you can communicate well, that is the only way you can do proper assessment, proper physical examination. Because especially in children, you need to have good rapport with our patient. You need to play with your patient. So that is why having good communication is very, very important. I give you another example, an example that I almost always will tell medical students. If you can imagine, if you can imagine, if you can imagine, uh, there's this makcik who sells nasi lemak. You will dengar this example from me many times. So if you can imagine one makcik that sells nasi lemak, kan? Uh, this makcik sells very good nasi lemak. Nasi lemak yang makcik ni jual memang superb, memang best gila-gila, best in the world punya. Kan? It is by experience. It is by expert opinion. Expert chef dah try, semua kata nasi lemak dia best. It is nasi lemak dia is so good even by expert opinion. Even you have randomized control trial. You try nasi lemak apa semua kata nasi lemak dia is the best nasi lemak. Kan? Tapi can you imagine makcik ni jual nasi lemak, dia main campak macam tu. Dia ada plastik, tak sok khabar, kan? Dia campak nasi, campak sambal, gol tak telur macam tu, kan? Presentation is very bad. How would you feel? Would you feel tempted to eat that nasi lemak? Even though there is evidence based. You have evidence based, you have experience. You know by fact that nasi lemak makcik ni jual memang super best. Kan? Would you feel tempted to try? No, sebab presentation dia buruk. Kan? Tapi can you imagine sebelum zaman COVID ni, ramai time orang semua boleh pergi hotel lah semua, kan? Nasi lemak dekat hotel. Kan? Anyone in the world kata nasi lemak kat hotel sedap? No one. By evidence based, by experience, everyone says nasi lemak dekat hotel memang tak sedap. Kan? Yes. Kenapa? Sebab presentation dia superb, kan? Dia ada apa? Nasi lemak dia susun, lepas tu nasi dia nampak shiny, ada asap-asap dia, sambal dia nampak merah mercik, kan? Telur dia pun nampak macam wah, kan? Ada pula station untuk buat telur tu, kan? So nampak very tempting. Semua orang tempted nak try. But you know by experience memang tak best, kan? You know by expert opinion nasi lemak dia memang tak best, but you still want to try. Why? Because presentation is good. So that is why again, when you present a case, kan, in any setting, because you guys are going to present cases nanti as doctor semua, good communication, good presentation, good presenting skills is very, very important. Because if you present well, even if you make errors, people may sometimes ignore those errors. But if you do not present it well, even though your presentation is complete, sedap, cukup, tapi if it is not presented well, tak bungkus dengan baik, tak susun dengan baik, kan? Even you do not have errors, people will fault you. So this is one thing that you need to remember. Okay. Alright, fine. Communication in pediatrics. So it's very important. The first thing I want to remind you all is children are not small human. Children, they are not just homunculus. You tahu homunculus tak? Homunculus atau homunculus? Masa belajar anatomi mesti belajar homunculus apa benda kan. So homunculus is a miniature human being kan. Siapa yang biasa tengok anime Full Metal Alchemist, saya tahu lah. Homunculus. So homunculus is tapi dalam Full Metal Alchemist tu homunculus taklah kecil pun. Kan? So children, they are not just homunculus kan. They are not miniature human being. They are not small human. They are actually by themselves. They are different at every different stages of life. At different ages, they are different. They have different capabilities. They have different cognitive capabilities. They have different motor capabilities. They have different speech capabilities. They have different comprehension. They have different visual capabilities. They even have different bugs infecting them. Kan? At newborn age, different bugs, different organism infect them. At less than 3 months old, different bugs infect them. At infancy, different bugs infect them. At toddler age, different bugs. At every stage of life, they have different bugs infecting them. So that is why they are not just miniature human beings. They are not just small human, but they are by themselves. They are different at different stages of their life. Different upbringing. Upbringing affects how they behave. The upbringing affects how you should behave with them. Upbringing affects how you should communicate with them. Parental expectation as well. Upbringing affects how you should communicate with them. Certain cultures you cannot speak to their child without their parents, for example. But certain culture they don't mind you speak whatever. And so parental upbringing, culture, and so on and so forth is actually important part of communication with children. Newborns are still to be communicated with. This is an issue. I'm a neonatologist. I'm a pediatrician. But my subspecialty is neonatology. I handle newborns. Newborns are you still need to communicate with newborn. You still need to speak with babies. Newborn babies, can they speak? You don't expect newborn babies to speak. If they speak, you should be terkejut, shocked, and something is it. Newborns they don't speak. But do you need to speak with them? Yes, and don't speak with baby language. Kan? Speak with proper language. English ke takalam Arabi, whatever language you want to speak, but speak properly with them. You need to speak with them because newborn babies, they can respond to social cues. They understand, smile, and so on and so forth. Yes, a capability to because they newborn they can smile, but they don't smile socially. They don't smile on cue. But can they smile? Yes, they can smile. But can they understand your smile? Yes, they can understand your social cues. Facial expression, they can understand. That is why baby, kalau you marah kat dia memang akan nangis. Sebab they understand. When you are angry at them, they understand. This is anger. This is not to be messed with. So they understand. So that is why you need to communicate with them. You need to communicate with them. And you remember as well, the first milestone, the first developmental milestone is social smile. So they understand the social cues. So speak to them. Studies have shown newborn babies that are spoken to in proper language, they have better language capability later on in their life. Newborn children who are being read with, yang dibacakan buku, they have better literacy rate later in life. They have better command of language later in life. So that is why read to babies, speak to babies in the proper language, bukan baby language. Baby language are for babies, not for adults, kan? And then they sense, obviously newborn babies, they sense parental voice that are exposed to them antenatally. That is why the first sensory that is developed is actually hearing. Quran says inna sam'a wal basar, kan? You develop your hearing first and then your sight. So hearing is the first sensory that is developed. So they can hear if the parents used to speak to them antenatally, masa di dalam perut, if the parents used to speak to them, they can understand this is my mother, this is my father. They understand that they are used to those voices. So that is why you need to speak with them. You need to read with them. And studies have shown as well, some rhythmic sounds is actually it helps in terms of improvement. There are studies suggesting rhythmic sound macam contohnya classical music. Some studies shows babies who are exposed to rhythmic sounds, they have shorter length of stay. They are easier to be extubate if they're intubated. They're easier to extubate and so on and so forth. So that is why exposing to rhythmic sound is important. And what type of rhythmic sounds we have as Muslim? Quran. So Quran is among the best. In suspect, for example, we always play Quran in the background because Quranic recitation, waratilil Quran tartila, kan? Rhythmic sounds with Quran is actually therapeutic, kan? Waratilil Quran tartila, Quran says, Allah says, waratilil Quran tartila. Oh, Umar. So, apa nama, waratilil Quran, Allah asks us to read Quran with tartil. So tartil means you read in the proper tajweed and so on and so forth. One thing if you guys ever exposed to psychiatry and so on and so forth, among the techniques for depression, if you're stressed, one of the techniques is actually breathing exercise. Breathing exercise is macam mana? For example, contohnya, you breathe in with your nose and you release slowly. You breathe in and then you release the breath. You expire slowly. You breathe in and then you breathe out slowly. You breathe out slowly. Kan? So breathing technique. You breathe in, you hold your breath, you breathe out slowly. Breathing technique. Breathing technique regulates your heart rate, regulates your emotion, and so on and so forth. And among the best breathing technique is actually by recitation of Quran. Am I clear or is it too loud, the background noise? Because my children, seorang tengah main game kat PS4, seorang tengah tengok anime kat bawah tu. Huh? Is it too loud or is it okay?
Okay, Doctor.
It's okay, Doctor.
Okay, alright. So rhythmic sounds are very important. Waratilil Qur'ana tartila. Alright. Okay. Then when you communicate with the patient, with the patient or with the parent, communication session, interview session, clerking session, it should be a planned session. You need to plan the session. Ideally, it's not an impromptu session. Yes, sometimes you need to have impromptu session, but even if impromptu, you need to plan what's going to happen, how to plan. So the first thing is you need to have clear objectives, because even the Prophet said, "Innamal a'malu binniyat." Kan? Whatever your action is by your intention. Faman kanat hijratuhu ila dunya yusibuha aw imra'atin yankihuha. So whatever you do is based on what is your intention. You will achieve what is your intention. If your intention is just to pass exam, you will pass the exam. If your intention is to become a good doctor, you will become a good doctor. Yeah, so that is why you have to have clear objectives. So the session as well should be a planned session with very clear objective. What do you want to achieve? Is the session for you to clerk patient to get history, or is the session for you to actually assess developmental assessment, or is the session is actually for you to counsel about results, or is it for you to counsel about diagnosis? Is it for you to teach parents how to do CPR, how to do basic life support? Is it how to assess feeding? So what is your objective? Is it to plan what's going to happen after the discharge of the patient? What's going to happen? What are the risks? What are the possible complications? Or is it a session for you to discuss about a medical error that has happened? Drug error, for example. So what is the objective? And clear the objective. And this objective should be shared among all the participants. You tak boleh, you seorang ada objektif, orang lain ada objektif lain. Tak boleh. Everyone should share the same objective. Ada wahdatul fiqh, baru ada wahdatul amal. Kan? So, and then it's not just that, you need to have appropriate personnel. Who should be with you? Do you need someone else to be with you? Do you need the parents with you? Do you need both of the parents to be with you? Or one is enough? Do you need the father? Just the father? Or you need the mother as well? Or do you need the mother without the father? So who do you need to be with you on the session? Or do you need surgeon to come with you to counsel about things? Do you need occupational therapist? Do you need dietitian? Do you need the nurse to be with you as witness? Do you need PPK? Do you need who? Do you need your consultant to be with you? Do you need your MO to write? Do you need your HO to write the minutes and so on and so forth? So who do you need with you? Or do you need interpreter, for example, if the patient speaks language that you do not speak? Do you need interpreter to be with you? Or do you need, sometimes you discuss about some probably for example perinatal asphyxia. The baby is having perinatal asphyxia, hypoxic ischemic encephalopathy because of perinatal trauma. Or the baby has clavicular fracture because of shoulder dystocia, because of obstructed labor, for example. Do you need ONG to be with you as well? So who are the personnel you need to be with you? You need to have the appropriate personnel. Or is the patient of different gender? So do you need someone to be your chaperone? So appropriate personnel. And it must be scheduled time. Why you need scheduled time? Because with scheduled time, you won't have any disturbance. Tak ada kejap-kejap nurse panggil. Tak kejap ada patient, ada bagi tahu doktor patient collapse. Ni. So you should not have a lot of distraction. So it should be scheduled time. So everyone will prepare to attend the session. And for the session, it needs preparation. You need to have all the adequate information for you to have the session, appropriate personnel, and you need to ask the parents early on. Do you have any questions to discuss in the session? Do you have any concern that you want us to address in the session? So plan the session properly. Settings. So how do you set the session? So the session should have privacy, because for example, you have certain issues that you need privacy. If you want to discuss about diagnosis, for example, you don't want other parents to know the diagnosis. Or you discuss about HIV positive, for example. You discuss about COVID, for example. You don't want the whole world to know the patient has COVID, kan? Because COVID stigma, kan? You don't want. So there need to be element of privacy. If you're telling a parent that the child is dying, for example, you need to have the setting must have privacy enough that the parents can cry, kan? So you need to have proper privacy. It needs to be comfortable. For example, if you're counseling a mother that the baby is dying, you need to make sure that you have the proper chair. Proper chair tu maknanya you tak boleh ada chair yang ada roda yang senang jalan. Sebab apa? Sebab sometimes mother dia jatuh. Dia boleh jatuh dengan kursi macam tu. So you need to have chair that is fixed, tak bergerak. Kan? Yang you boleh move, tapi chair tu tak easily movable. Sebab kalau mak dia jatuh pitam apa semua, dia stable. You need to have stable chair. For example, you need to have appropriate personnel, as I've mentioned before, and the room must suit the purpose. Kan? Macam contohnya, you nak buat session to teach parent how to do basic life support, how to do chest compression, for example. You need to have the room that you have oxygen, or you have appropriate equipment, for example, kan? So it must suit the purpose. Should be no disturbance. Should be no disturbance. Tak ada kejap-kejap bunyi ventilator, kejap-kejap bunyi alarm, kejap-kejap bomba datang lah, bunyi bomba dan sebagainya, kan? So not much disturbance. Next, introduction. This is another element that sounds easy, but students always forget about this. Introduce the attendees. Tell the attendees who you are. I am Dr. siapa. Kan, introduce. Not just you, introduce whoever there with you. Contoh you nak club patient ataupun in exam. Introduce yourself. I am student, nama siapa, this is my lecturer, this is siapa. So introduce everyone. And do not just introduce. You introduce their role. So this is my lecturer. Apa yang dia buat dalam kelas ni, everything, the role there, and those role you need to inform. And you need to have consent for the session. What do I mean by consent for the session? Consent for the session tu maknanya, bila you dah introduce, okay, saya siapa, ini doktor saya, ini siapa, siapa-siapa. So hari ni kita punya tujuan kita, you bagi tahu objektif again. Tujuan kita hari ni saya nak dapat cerita pasal apa penyakit anak ni. Kan? And boleh tak saya dapat cerita tu? Ask consent. Kan? Hari ni kita nak discuss pasal anak ni, kita dah dapat, anak itu ada buat test, kita dah dapat result test tu. Hari ni kita nak discuss pasal result test tu. Okay, boleh kita proceed. So get consent for you to continue the session. Whatever the session is, exam, whatever it is, get consent, verbal consent. Do not start anything without having consent for you to start the session. Next, ascertain the objective. Make sure everyone, all the attendees must know the purpose, the objective of the session, and everyone shares the same objective. Know the background. So whose background? Background of all the attendees. Background of the parent, and background of the surgeon, of whoever attends the session with you. Know, have an idea about who they are. What the language do they speak? Kan, tak boleh lah you panggil parent, you nak counsel parent, tapi parent tu cakap satu language yang you don't understand, you can't speak. So what's the purpose? Kan buzzer je panggil semua, prepare everything, tapi doesn't serve the purpose. So what language do they speak? You panggil surgeon susah payah, kan? Sekali surgeon ni hanya boleh cakap Arab saja, tak pandai cakap bahasa lain, kan? Tak boleh macam tu. Or the surgeon can only speak in English. Parents don't understand sehabuk pun English, kan? So you pula nak kena translate, kan? So sometimes understand, have an idea language, what language do they speak? Do you need translator to be with you? Do you need some of the another healthcare personnel that can speak the language to be your translator? Do you need language line? Certain hospital ada language line, you boleh call through, ada operator, you boleh kata boleh tak I want someone who speaks this language. So dia ada personnel yang boleh cakap that language. Kan? Level of education, because level of education and work. Because if you counsel a parent who's both are doctors, you need to speak with different language. You cannot just speak macam you cakap dengan layman, kan? If both parents are pediatrician, you need to speak at different level, different depth, kan? If both parents are, for example, anti-vaccine, for example, you need to speak differently, kan? Not to judge, but to the Prophet says, "Khatibun nas ala qadri ukulihim." You speak to people based on the level of their intelligence, based on the level of their, because the depth of your communication, the depth of your discussion depends on their level. And not just that, level of prior understanding. Ask them, Mak, I assume someone has already spoken to you about this matter. What have you understood about this disease, for example? Kan? Mak, we've done this test last week. Hari ni kita discuss the result. Have you read about the result? Do you know what's going to happen with the result, for example? So ask what is their level of prior understanding, because kalau dia dah ada some idea, there's no need for you to go start from zero. You can start from where they understand and expand from that. And you can assess as well whether they have wrong understanding, because sometimes they have read from Google pula bagi idea macam-macam. Probably they have wrong understanding. Probably someone have spoken to them wrongly, kan? Ada kadang-kadang ada HO ke siapa cakap tak apa-apa punya idea, wrong idea daripada knowledge lama, for example, kan? The knowledge have changed now, kan? By evidence, knowledge have changed, kan? So probably someone has told them something wrong. Probably dia ada family dia yang doktor, so dia dah cakap, and they have some idea. So ask them what is their understanding prior to the session, so you can know whether where should you start, how deep you should go, and where should you focus. So assess their level of prior understanding and assess their expectation. Okay, Mak, kita discuss pasal ni, apa yang mungkin Mak expect daripada kita nak dapat ni. So you can actually address their concern and expectation. Assess understanding, as I mentioned before. Assess level of comprehension. Assessing level of comprehension ni should start before you begin. Sebelum begin, you tanya dulu apa dia faham. And not just before you start. Throughout the session, you need to assess. You need to ask balik. Mak faham ke setakat ni? Sebelum you proceed to another topic, for example, assess comprehension. Faham tak? Clear tak? Kan? Always assess. Tak boleh, tak ada guna you cerita panjang-panjang lebar. Kan? Sejam lebih you berkhutbah. Sekali, they don't understand one iota of what you have spoken. Kan? So, assess their understanding at every level and every stage. And use language accordingly. How you do you need to call language line? Do you need to have appropriate personnel that can speak the appropriate language? Use ideally avoid using jargon. Kalau tengok rubric in your exam, ada item. Rubric tu ada item not to use jargon. Kan? So you should not speak. You should speak layman to layman. Kan? So avoid jargons where appropriate, but use jargon where appropriate as well. Sometimes you need them to understand their jargon. They need to understand G6PD definition. Kan? You need to give them the idea of the jargon tu. Kan? So, or if they are medical doctors, for example, so use jargon when appropriate. Cover the concerns. Address all the concerns. Address all their concern. Apa concern dia? Apa issue dia? Address all the issue. Address all the concern. Assess and address. Reassess understanding, I've mentioned before. Reassess comprehension at every level. And not just that, before you end, always try and formulate conclusion with the parents. Okay, Mak, kita dah bincang pasal anak ni ada diabetes. Dah sejam dah kita bincang ni. Okay, so boleh tak? Okay, sekarang ni kita plan. Okay, so daripada saya dah cerita tadi, anak ni ada diabetes. Diabetes ni adalah type 1 diabetes, tak ada insulin. Tak ada insulin ni sebab ni. So plan dia anak ni kena ambil insulin banyak ni. So formulate conclusion together with the parents. Sama juga you Clark. Bila you Clark patient, you sama, okay mak dah cerita tadi macam ni. Betul ke? So formulate conclusion together. Kan? Bila sama-sama achieve a conclusion, that will be stronger. Kan? Cerita kat mak, okay, anak ni ada asma ni kena buat treatment macam ni. Okay, setuju? Faham? So baru they can agree to a action. Okay. Other important points about communication. First is empathy. Empathy is you show appropriate emotion. Can you be emotional? Some people say you shouldn't, as doctors, you shouldn't be emotional with your patient. No, my idea is you should not be emotionally attached to your patient that it affects your professionalism. But you should and you can be emotional together with the patient. You should not be emotionally attracted, emotionally affected by the patient, but you can share the same emotion with the patient. You can cry together with the patient. Tak boleh lah you cerita anak patient tu dah meninggal. You pula sengih-sengih. Kan? Tak boleh. Kan? You need to show appropriate emotion. Kan? Anak dia meninggal, you cerita kat dia anak dia meninggal, mak dia menangis, you pula sengih-sengih ketawa-ketawa. At the background tu, nurse lain, staff lain semua ketawa-ketawa at the background. That's kurang ajar kan? So you should show appropriate emotion. Tak boleh pula you cerita, okay, anak successful, kemo dah berjaya, happy, mak gembira, lepas tu you pula buat muka sedih. Kan? Tak boleh. So appropriate emotion. Kan? Tak boleh pula you cerita benda sedih, tapi muka lain. Sebab actually facial expression shows honesty and trust. Facial expression is very important. And try and understand their feeling. Macam mana mak rasa bila dengar cerita anak dia ada diabetes, for example. I've had one patient before in Susmed. This is a 11 years old girl. Dia ada grave disease. Dia ada hyperthyroidism, thyrotoxicosis with grave disease. And then this child was admitted to us with diabetic ketoacidosis. Kan? Dah ada thyrotoxicosis, grave disease, complicated. Memang ada goiter besar pula. Budak 11 years old girl. Kan? Lepas tu pula complicated dengan newly diagnosed type 1 diabetes, came in with diabetic ketoacidosis. Kan? Dah ada satu lagi problem yang huge punya kan. Macam mana try to understand their feelings. And I can tell you, sometimes mothers they have different concern as compared to us. Contohnya mother ni, one day I found her crying. I asked her what's the issue. apa problem dia. Dan dia kata actually her concern is anak dia ni perempuan kan, apa masa depan dia nanti, macam mana dia apa nama later on kahwin semua macam mana kan. That is her concern kan. Dia tak concern sangat sebab dia tak concern sangat pasal compliance to medication sebab dia tahu her child will comply to the medication. We are concerned, budak tu bawah 11 tahun macam nak comply to insulin injection. Mother not worried about that. Mother worried about future. Mungkin ada penyakit lain tak pula sampai nanti. So mak concerned about something else. But you as doctors, you need to try and understand their feelings. Question, how to ask question? Open-ended question, again, open-ended question is ideal. You need to use open-ended and close-ended questions appropriately. Open-ended is preferable, but you may need some close-directed questioning if needed. Close-directed questioning is not bukan yes/no answer, tapi sometimes mana you need to ask. Sometimes patient kita bila kita tanya dia pergi meleret, dia cerita pusing jauh kan. Sometimes you kena direct them back to the questioning line. But do not feed words into the mouth. Sometimes bila you yang bagi word tu, dia akan kata sebab dia malas nak layan, dia kata betul macam tu lah kan. So you do not feed words into their mouth. Be careful with that. Sometimes you yang tanya, sakit tu macam ni ke? Sakit tu macam ni ke? Before you ask them, sakit tu macam mana? Boleh describe sakit tu kan? Sometimes dia akan try. Sometimes parents nak sakit tu dia tak reti nak sakit macam mana. So you boleh guide them. Sakit tu macam mencucuk ke, panas ke, ataupun sakit macam mana. Kan? But you don't give sakit tu macam mencucuk ke? Dia bagi satu option je. Kan? Of course dia jawab, ya kan? So do not feed words into their mouth. Give options. Ideally open-ended. Cuba cerita sakit tu macam mana. Kan? Tapi cerita sakit macam mana tu sometimes it's difficult. Kan? So you need to guide them. Sakit tu macam kena tekan ke, atau sakit tu panas ke, mencucuk ke, sakit tu macam kena tekan ke, macam mana. You give them options. Kan? You guide them. Close directed. Bukan close yes no. Because yes no sometimes you are feeding words into them. And people when you feed words they tend to kata betul kan, especially kalau you pun cakap pun macam menyampah kan. Orang menyampah kita dia macam dia kan. So tak katalah. And be a good listener. So you can only be a good speaker if you are a good listener. You can only counsel properly if you listen to people. If you listen to your patient, then only you can counsel them properly kan. So kena listen to our patient. Non-verbal, this is another important aspect. Non-verbal. So non-verbal, actually 80% of communication actually from non-verbal. Even though you try to give knowledge, but actually 80% is relayed by non-verbal. How non-verbal? First, intonation. Maknanya tak boleh lah berita gembira, you bagi intonation macam intonation yang slow kan. Anak kemo berjaya, alhamdulillah. Tak boleh macam tu lah kan, you kena happy lah kan. Tak boleh pula berita sedih, you pula intonation mak, anak dah mati. Tak boleh, you tak boleh macam tu. Intonation must be appropriate. Intonation must be appropriate. Kan? Facial expression, I've mentioned before, appropriate facial expression for appropriate emotion. And appropriate body language, for example, kan. You tak boleh you cakap dengan orang, you buat defense posture, kan. You punya body language is defense body language, for example. Kena ada open body language, kan. Kan, you tak boleh you cakap dengan orang kaki angkat ke atas meja, kan. So appropriate body language. Position ni sometimes what I think is bila you communicate with people, dulu kan kita berdepan, you face directly to the people. The problem is when you face directly, lepas tu ada meja ke apa something tengah-tengah tu, it's sort of you are creating a barrier with them. Meja tu sometimes it creates barrier with them. And then the second is when you are opposite them, you are creating a subconscious mind setting that you are against them. Kan? Sometimes for example you nak counsel about you want them to agree to a procedure. Nak buat lambang puncture, for example, you nak them to agree to a treatment, kan? If you're opposite them, it gives an idea subconsciously that you are against them. So what I usually suggest is you go at 90 degree. Maknanya parents duduk macam tu, you go 90 degree to them. Or better still, you go by their side. Duduk sebelah-sebelah, sama-sama. Because when you are beside them, it shows that you are together with them rather than you are against them. Kan? So speak in side by side or 90 degree. So that is better. Next is proper ambience. Proper ambience. Maknanya, you nak cakap benda sedih, ambience dia kena sedih lah. Tak boleh lah ambience dia ceria, ada nak cerita anak dia dying, tapi bilik tu penuh ada belon, ceria-ceria, kan? Ada background muzik yang happy kat belakang tu. It's not appropriate. Ambience dia is not appropriate. So the session should have the appropriate ambience. You tak boleh nak cerita benda sedih, tapi background ni ada orang tengah ketawa-ketawa kat belakang. Tak boleh. So ambience dia kena proper. The session must have a appropriate ambience. And touching is very important as well. Touching ni apa? Touching ni you sentuh lah. Sentuh bahu, salam. Kan? Sometimes touching ni is actually very powerful. You cakap something, cuba you try. You cakap something kan, you sentuh bahu orang tu. You cakap satu point, you sentuh bahu. Sometimes that touching itself actually enforces, strengthen the information into their subconscious mind. So touching is very important. If you learn NLP, it's very good. Next is, these are all neuro-linguistic programming technique, mirroring. Sometimes mirroring ni is actually helps you to get the message across, gets into the subconscious mind, and it helps you to actually build rapport appropriately with them. Mirror tone. Kalau orang yang cakap tone dia a bit tinggi, you adjust your tone according to their tone. It will help you to actually in same groove with them. Kan? Mirror their tone, mirror their body language. Orang duduk, you kena speak with them, duduk juga. You tak boleh cakap berdiri. Dia tengah berdiri, you tak boleh cakap dengan dia orang duduk. You kena mirror them. Maksudnya, kalau dia berdiri, you pun berdiri. Kalau dia duduk sandar, you pun try, you pergi sandar sikit. Kan? Dia tengah berdiri sandar kat dinding, you nak reach to them, you pun berdiri sandar dekat dinding. Janganlah sebelah dia. Maksudnya, you try mirror them. Tapi bukan copy. Not copy. Bukan macam copy sometimes nampak mengejek. But you mirror them. Bila you mirror, actually, it gets into their subconscious mind. It helps understanding the topic and the issue. Next, so if you look at papers or many literatures about effective communication, people will talk about spikes. Apa spikes ni? Spikes are first S is setting up the interview. How do you set the interview? You should mentally rehearse. You need to plan the session. You mentally rehearse what's going to happen. Mula-mula nak talk about this and then this and then this and then this and this. What are the expected questioning, apa semua. You mentally rehearse the session. Arrange privacy. It should be sit down. Use open body language. If this talk should be face to face. I can show you what do I mean by open body language. How do you put your hand? This is defensive posture. Tangan cross macam ni is defensive posture. So use open body language. Tangan dekat tepi, tangan kat belakang. Those are open body language. And then P is for perception. Perception is you elicit what is the patient's perspective. Apa idea dia, apa perspektif dia pasal this issue. Assess what's their belief, apa dia percaya. Sometimes people, you cakap something tapi they have different belief. Kan? For example, if you speak to Jehovah Witness. Pernah dengar Jehovah Witness? Jehovah Witness ni another sect of Christian. Christian dia ada banyak sect dia. Dia ada the Church of England, dia ada Protestant, Catholic, macam-macam. One of them is actually Jehovah Witness. So, Jehovah Witness ni kat Malaysia tak ramai, tapi ada kat Malaysia. Jehovah Witness ni, for example, their belief is they cannot receive blood transfusion. They cannot receive blood transfusion from orang lain. Tak boleh. Kan? So, Jehovah Witness ni dia kena autologous transfusion. Maknanya, they can only be transfused with their own blood. And UIA is among the only hospital in Malaysia that offer surgery for Jehovah Witness. Kita ada equipment tu. Kita boleh keluarkan blood dia, proses, masuk balik. So, this is what we have in UIA. So, assess their belief. And because sometimes you will be surprised with people punya belief. What do they feel? How they feel about the issue at hand? Assess the vocabs. What vocabs you can use? I've mentioned before. If you speak to doctors, your vocab should be different. And so assess the appropriate vocabs to be used and assess the comprehension. And then I is for invitation. Invite them to ask. Kan? Ask the patient what they want to know. Apa dia nak tahu, invite them. Obtain permission to share knowledge. Before you share something, rather than you just, this is this, you give the knowledge, you get permission for you to share that knowledge with them. This actually is very powerful because the moment you ask permission to share, and it helps them to open their subconscious mind for the information to actually get into their subconscious mind. And then K is for knowledge, provide information knowledge in small pieces. Jangan bagi chunks yang banyak. Kan you give in small chunks. And use simple language as possible, even to doctors. You can use jargon, but you can use big vocab, but simple languages. And E is for emotion. Explore the emotion that is involved. And explicitly, clearly, explicitly recognize the emotion and empathize with them. And then S is strategy and summary. Set up medical plan of action. Sama-sama together dengan patient tu, you buat plan of action. Okay, kalau macam ni nak buat apa? Walaupun you dah ada plan tu, tapi you make the plan tu macam plan yang kita buat sama-sama with them. Baru dia akan share the goal yang kita nak. And arrange for follow up, offer them follow up. And make summary, buat summary sama-sama. So kita dah discuss, summary dia macam ni, buat summary sama-sama, tulis. Kan? Bagi copy apa yang ditulis tu, for example. Call for help. Call for help is another important aspect. What do I mean by call for help is offer to discuss with sini. You dah counsel, macam, okay, mak faham ke? Faham. Dah buat summary ke? Konklusi kita macam ni. Okay, mak rasa okay ke? Atau mak perlu nak jumpa dengan saya punya konsultan ke? Nak jumpa dengan senior ke? Nak jumpa dengan doktor lain ke? Nak dapat second opinion? Kan? Offer to refer. Mak nak jumpa dengan psychiatrist ke? Mak perlu pertolongan ke? Nak kita rujuk mak pada ONG balik ke? Nak refer pada siapa-siapa ke? Offer to refer and offer for follow up. Okay, kita dah discuss 1 jam. Perlu ke kita buat session satu lagi untuk discuss benda sama? Kalau ada benda yang mungkin tak faham lagi ke? Kan? Offer for follow up. Offer for repeat session. Because sometimes people, they understand tapi dia tak confident. Kan? Ataupun dia nak someone else to be present. Kan? You dah counsel pandang-pandang, dia faham. Tapi dia nak you explain to the father, for example. So offer for follow-up session. Next, other aids. Apa other aids? What do I mean by other aids? What I mean is, do you need visual aids? Kan? Do you need charts? Do you need drawings? Sometimes, for example, you counsel a patient that anak dia ada pattern ductus arteriosus. Obviously, it's good kalau you boleh draw. Heart ni right atrium, ni right ventricle, this is left atrium, this is left ventricle. Kan, PDA ni pula ni ductus arteriosus ni daripada so masuk in utero, lung ni penuh dengan air, so body creates 2 shunts dekat dia punya foramen ovale dengan dekat ductus arteriosus between the pulmonary artery dengan aorta. So bila baby cry, reduce pulmonary pressure, semua ni oxygen causes a vasoconstriction of the ductus arteriosus and cause the ductus to close because of prostaglandin inhibition, so on so forth. So sekarang ni the problem with your baby is the ductus arteriosus ni, gambar-gambar ni daripada pulmonary artery to aorta is still open. So problem dia banyak ada ductal shunting dan sebagainya. Lung will be filled with fluid. Kan? Do we need to draw? Kan? Do we need to draw bilirubin metabolism ke? Kan? What do we need to draw? Kan? So sometimes having drawing is actually important. Drawing is actually useful. For example, kan, tak kisahlah, my drawing is very bad. I know my drawing is very bad. But it is still useful even though it's bad. Kan? So, do you need drawing? Do you need charts? Kan? Kalau patient yang contohnya I have GCPD deficient, babies with GCPD deficient, sometimes we need charts. Kita nak ada pamphlet, for example. Do you need those pamphlets? Kan? So, other visual aids that may help. Some people, they are auditory. Some people are visual. Some people are kinesthetic. Some people are digital. So you need to assess them by their capabilities. Okay, so these are other aids. Okay, all right, fine. That's it. Habis dah. So understand? Clear? Boleh tak? So communication, it starts from the beginning. It starts from the intention. What is your intention for the session? Introduction, planning, setting up of the session, understanding the background, understanding the language to be used, assessing their comprehension, assessing comprehension at every level, having empathy, showing appropriate emotion, using proper non-verbal punya communication skills, using visual aids and so on and so forth. Okay, boleh. So need to improve communication. Need to improve communication. Again, I've said before, you are a students, knowledge, your knowledge are actually at par with students in UK and so on and so forth. But the problem is, you guys communication, presenting skills is the one that is a bit problematic. Yang tu nak kena improve. Okay, any question?
How do I? Can you not like?
Exactly 57 minutes. Any question?
Doctor.
Yes.
For what about, for example, when we ask concern, then they decline. So what do we do?
The first thing is jangan gabra. That's the first thing. Jangan gabra. It's okay. People not answering question is okay. It's usual. That's the first thing. Secondly is you need to know why they don't answer. Is it they don't understand? Kan? So sometimes if they don't understand, you need to formulate, you need to reformulate your questioning. Because sometimes the problem is not with the answer. The problem is with the question. Kan? You don't question properly. Probably the one that is wrong is not the answer that is wrong. Probably the wrong is wrong question. Kan? Not appropriate questioning. Wrong person to ask or wrong person to be asked. Kan? So what is the reason? Or is it they don't understand the question? Or is it they don't want to speak to you? Because sometimes we've had patient before, dia rasa dia dah ramai sangat orang kelak dia. Kan? Bila orang tanya dia macam, "Hai, you tak baca I sakit ke?" Kan? Tak ada rekod ke? Setiap kali nak tanya soalan yang sama, kan? Some people they get irritated like that. Kan? So sometimes you just need to explain to them. I know ada orang dah tanya, tapi saya doktor lain. Saya tanggungjawab saya ni, saya perlu juga tanya sekali lagi ni. Ataupun minta maaf, saya tahu doktor dah tanya, saya medical student. Saya nak jadi doktor, tak lama dah nak jadi doktor ni, tak sampai setahun nak jadi doktor. Saya kena belajar tanya soalan. So explain to them why. Especially medical student, medical student memang orang kadang tengok medical student je dah, alamak, kena tanya soalan balik. Nanti nak kena cerita kat doktor, cerita kat medical student tak dapat apa-apa, kan. Sebabnya yang nak treat doktor, kan. Ramai orang kadang bila medical student tanya, dia tak nak jawab, kan. So you need to explain to them lah, kan. Mak, nak tak doktor yang treat tu doktor yang bagus, tanya soalan, kan. So kalau nak, bantu saya. Sebabnya saya akan jadi doktor. Mungkin anak mak nanti saya yang treat, kan. Kalau saya tak erti tanya soalan, kan, macam mana saya jadi doktor nanti? For example, kan. So, you kena pandai lah. Sebab tu kena pandai goreng, kena pandai cakap, kan. So you need to know why they don't want to answer. Is it they don't want to answer? Ataupun sometimes dia dah menyampah kat you, kan. For example, sometimes sekarang ni semua orang ada social media presence. I've had patient sebelum I treat them, sebelum I meet them, they have googled me. Dia dah tengok Google, dia dah tengok dia dah tengok my social media, what I comment in my Facebook, and in which TV shows, radio that I've spoken in, kan. Belum apa-apa, doktor, saya tengok video doktor kat TV Astro Awani tu, ni. Belum apa-apa lagi, kan. So sometimes they have ni, dia tengok, doktor ni orang parti warna kelabu, for example, kan. Aku orang parti warna biru air laut ataupun warna apa-apa warna-warna lah. Warna purple kan. Aku parti color purple. Doktor ni parti color kelabu kan. Itu tak geng ni kan. For example kan. So that is why be careful with your political punya ni. So sometimes is it because of that kan. Ataupun sometimes tak jawab sebab you busuk for example kan. So understand why do they want to answer. Zakwan, if we found signs of abuse on patient's body, what do we do? Are we going to ask the parents' history of abuse? Okay, first, if you history of abuse is very important to us in pediatric patient. One thing. Number two is if you found anything that is suggestive of abuse, as medical personnel, you are obliged under the law to actually investigate and report. You are obliged. If you do not report, you can be compounded. You can be sued. You can get into you can be. It is against the law for you to not do anything. Faham tak? So if you found anything suggestive of probably there's abuse, you are obliged by the law, Child Act, Malaysia punya, for you to actually investigate and report. Cuma what level of investigation and report tu, that can be discussed lah. Main tak semua case you kena pergi report polis. Kan? Your report probably at your level, probably just report to doctor, probably just report to your senior, probably just report to the consultant, probably just report to the medical social worker, probably to just report to the kebajikan, kan? Kan? Tak semua case you terus kena pergi ke polis. But you are obliged under the law to actually act and document whatever you do. Because if you don't document for pediatric patient, you can be sued even after 25 years. Whatever you do now, 25 years later, they can still sue you for what happened 25 years ago. That is why document properly. Okay. Any other question? Faham tu Karami? Simple lah topik ni. Kan? Okay, tapi important lah. I think it's very important. Okay. Alright. If there's no other session, let's end the session with Tasbih Kafarah and Surah As. Subhanallah.